Tucked away at the Woodbury Public Safety Building is a rather unexpected team member of the Woodbury Emergency Medical Service. He's about 10 years old, he's a little accident prone, and some of the EMS staff members think he's a bit of a stiff.
Yes, I'm quite nauseous.
The team calls him Sim Man.
So the gold standard in education now is simulation. So the whole goal in EMS education is to create the most realistic training environment possible so that when people get out in the field, they're not surprised by what they find with people. Things like SimMan help us to create an educational experience that is realistic and is relevant, which is something that's very important to adult learners.
SimMan is a hydraulically operated simulation mannequin. Hydraulic lines that run to his back give him the appearance of breathing and even gives him the ability to speak to first responders.
And so to have something such as SimMan, to be able to say, this is what your patient would look like, this is how they would present, these are the kinds of symptoms they would have, is invaluable. It really adds to the educational experience. It gives a different perspective of this is what I'm actually looking at.
SimMan is hyper-realistic. He has rubberized skin that mimics real human flesh, tubes that simulate veins, which can pump simulated blood, as well as many other moving, functioning parts.
So what Lauren's demonstrating is IV insertion, which is one of the big skills that we do as paramedics. She can feel where the vein tracks actually are, what the vein actually feels like under the skin, and then when she goes to start the IV, she can start it the exact same way that she would with a normal person.
SimMan spends most of his time in the simulation room. On the other side of a two-way mirror, a Woodbury Paramedic, or EMT, can run a variety of training scenarios.
The computer connected to the mannequin is actually generating electrical patterns that are the same that you would find on a normal person. So then we can also mimic disease processes, so that would change those waves and do the diagnostics that we would do on an actual human being.
These trainings give paramedics and EMTs the ability to practice life-saving methods they couldn't normally perform on a live subject.
By giving students and myself the opportunity to actually work on an actual simulated patient, to be able to do compressions, to be able to give those medications, to be able to do those procedures, gives us the opportunity to rehearse them, perfect them, and then we're not trying to learn those things on an actual human being.
SimMan may be a bit of a dummy, but he's helping Woodbury Public Safety learn the best methods for saving lives.
I feel better now.